Hello, I'm Dr. Warren. I want to run through the top 3 reasons I see why antibiotics can fail when you're dealing with Lyme disease. Now, in the initial phase when we get bit, we know if we get antibiotics within the first 30 to 60 days, maybe up to 90 days, it has an 80 or 90% success rate depending on exactly which stats we're looking at. Well, what are reasons why it may not work and why you may still be sick even after you've had that standard initial treatment? These are the top 3 reasons that I see: persister cells, biofilms, and co-infections. Let's talk about each one briefly. So persister cells is something Lyme can do much more effectively than other bacteria. And I want to highlight here a study done at Johns Hopkins University, and just note the title. In this study, they're studying growing and non-growing forms of Borrelia burgdorferi, or B. burgdorferi, which is Lyme. Lyme has an initial phase which is growing, which generally responds well to antibiotics, and it has a non-growing, or what's called a stationary phase form, and this form is much more antibiotic resistant. And Lyme can transition from that growing to a non-growing form in order to survive an antibiotic round, and it can do this successfully in some people. The longer you've had it, the more likely it's to happen, but it can still happen on some people in a short term. If we've gotten the antibiotics right away, there's still a chance that Lyme can switch over into that persistent stationary form that has a slower life cycle and leads to more chronic problems than the quick acute problems. Now, this picture that we have is trying to illustrate this, and this was a picture by a speaker that I really, really like. And what I want to highlight here is there's green and yellow bacteria in this picture. And the green and yellow bacteria are the same. They're meant to be Lyme. The green is in the growing phase and the yellow is in the non-growing phase. And the antibiotics work to kill the green, but they don't work to kill the yellow. Once again, it's not 2 different bacteria, it's Lyme and Lyme in 2 different forms. And then the problem is when we stop the antibiotics, the yellow form can grow and cause more problems, and even turn back into the green and come back and cause problems. Lyme is successful at getting into the stationary phase or the persister phase, and therefore it evades the antibiotics. Okay, the second reason why we see Lyme fail is biofilms. So Lyme is able to create what's called a biofilm, which is kind of a protective layer around the bacteria that prevent the antibiotics from physically getting to it, helping to kill the bacteria. So what we really see for biofilms, the most familiar you probably are is the plaque on your teeth. This is an extracellular protein matrix created by bacteria to physically block and protect itself. Now, what happens is if we take antibiotics, we'll kill the free-floating bacteria, but if Lyme has successfully created a biofilm, the antibiotics do not get to the bacteria that are inside of the biofilm and protect it. And then we stop the antibiotics, and then it happens as biofilms periodically burst and release new bacteria into the system, and thus we get the biofilm protects it while you're on the antibiotics, and then once you're off the antibiotics, it bursts and you get kind of reinfected, or it really just grows back, and we remain sick or we become sick again. So the second reason that we have for antibiotics failing is biofilm. And the last reason we really want to talk about is co-infections. We have other videos where we go really more in depth on co-infections, but just know that Lyme disease is not the only thing that ticks carry. And when we start to talk about people who have problems chronically, meaning longer than 3 months, this hasn't gone away in that initial setting, over 90% of people in this group have co-infections. So it's called Lyme, and there's a doctor who calls it multiple systemic infectious disease syndrome. Multiple infections is the key word there. So when it's not going away initially, we're also concerned that you have something along with the Lyme, and it's the combination of these 2 or 3 things even that's preventing you from getting better. So it's Lyme and Bart, or Lyme and Babesia, or Lyme and Powassan, etc. And it's that combination. Even if you get the antibiotics really fast, not everyone gets better. It's got a 10 to 20% fail rate. It can happen because Lyme changes into a persister cell, or a stationary or a non-growing cell. Lyme has a biofilm that protects it. Or the third is we have co-infections along with the Lyme that protect it and stop you from getting better. So if this has happened to you, where you've taken antibiotics and not gotten better, we know this happens a certain percentage of the time, and you may need to work with a doctor who knows these things in order to help overcome it and get back that healthy life that you can have. I'm Dr. Warren. Hope you found this helpful.